back to my channel. This is your girl Nurse Shar, Nurse Gang. Welcome back to my channel. Just wanted to do another video. I know it's been some months, actually like 4 months to be exact, since I made a video, but I've been transitioning. I actually relocated. I'm still in the Midwest area, but I relocated from one state to another. So I've been working on that. I am back in school, of course. We talked about this before. I'm currently at LPN going through the LPN to RN Bridge program. So that's what I'm doing now. So I have to move to another state, you guys. And I started back in school, a whole nother school. It's a lot, okay? So I apologize for taking so long to do another video, but I had to get settled, okay? This video, I wanted to talk about the LPN to RN transition class. So when I wanted to do the bridge program, I've seen like a lot of people post about the differences between the LPN and RN and all that good stuff. However, I couldn't really find like a video that actually talked about the transition course. Now, I do know some people that have taken the bridge program and they're like, oh, that's a hard class, that's a hard class. So I don't know, you know how we do. I went on YouTube. I'm like, I want to see like what is this class really about? And it was so hard to find any videos that actually talk about the actual course, not just the bridge program, the actual course, okay? So I just want to talk about that. So again, I'm in a new state. I'm in the LPN RN Bridge program. I am currently, look y'all, these are 16-week courses. I am taking five classes at once. Like, y'all know how these private colleges are, okay? They gonna get their money. They gonna get their money some way, shape, or form. Like some of these classes I literally have already taken. Microbiology, I've already taken, and I actually took it a year ago. Like, but of course, if you don't take it at their college, sometimes they won't accept it. And anywho, that's one of my 5 classes I'm taking, and of course that comes with a lab, so that's additional class. I'm taking a transition course, lab for microbiology. I'm taking a dosage calculation class. Why do we need a whole class for that? I don't know, but again, okay. What else am I taking? Oh, and mental health. So I don't know if that was my 5. Okay, so I'm taking 5 classes. So it's really, really a lot. But at the end of the day, I know my ultimate goal is for me to be a nurse practitioner. And of course, in order to do that, you have to come and take the steps that's necessary, right? So let's get into the course. Okay, so the LPN to RN transitional course class is pretty much a class that talks about transitioning from the LPN to RN, which, I mean, this is the first course that I'm taking in the program, and believe it or not, it's actually kind of hard to reframe your mind from thinking on an LPN nurse level to a RN nurse level, because we're taught so many things, especially because when we work in long-term care, a lot of the times it could be 5 nurses in a building. 1 out of 5 is going to actually be an RN, and the LPNs are going to be kind of forced to step in to do the RN role. Not saying you're getting out of your scope, but just saying a lot of things that they tell us LPNs can't do and we don't do, they delegate it to us and we end up doing it anyway. So it's kind of hard to come from the mindset of LPN to RN, because it's like, it's kind of like a thin line. So this course, it actually is really important. So it, you know, shapes your mindset to know the difference between the actual roles and the scope of practice. Of course, that can be different for every state. So, but in general, the scope of practice for a LPN, LVN versus a RN. So that's one of the things. So they do that in 2 different ways. They do it in theory, which is like the classwork, in the different topics, and then they also do it in a lab. Now, every state is different. Some states, your LPN or LVN program already teach you how to do IV. Like I was already IV certified, but some states don't include that in your LPN program. So as far as like a lab for the LPN to RN, that will be one of your skills that you learn, or if you already been doing it, that you have to brush up on. So that's one of the labs. The other lab, I'm sorry y'all, my paper right here, I'm trying to read because it's so much. So let me see. So theory, I'm gonna go back to theory. So we talk about the nursing process, which is ADPI, and then they talk about the different principles and also delegation, ethicals, and the legal processes and things like that. That you would do. So it is really important for you to know your scope of practice for the CNA, for the LPN and the RN. Okay, so it's like you kind of they go over those millions of delegation questions. Okay, if you have a CNA, you have an LPN, who's going to do what? If you have just an LPN and you, which ones are you going to do? And some of the questions are kind of tricky because, again, when you're working in long-term care, it's like, I can do that. But of course, when you are RN, you have to put on your RN hat and say, hey, if I'm an RN, I'm going to delegate these particular things to the LPN while I kind of tend to the most critical patients. So it reframes that mind of thinking, okay? So again, y'all remember in nursing school, if you already LPN, you already know there's a difference between the real world and NCLEX world. So when you are in this class, you need to think NCLEX, right? NCLEX world. All right, so the other thing they do is have a lab portion of the class. So in the lab, some things you're going to learn, we already, of course, do wound care, but you're going to do, more in depth on wound care and the process of like skin healing and things like that. We're going to do IV insertions, freshen up on that, or have you IV certified, whichever one works. Pertains to you. Also administering blood products, because I don't care where you are. From my understanding, LPNs cannot do any blood administration products, from my understanding. So that's out of our scope. So of course, while you're in transitions, that's one of the labs you're going to do, is learn how to administer blood products. We haven't did that yet, but I'm really interested in doing that because that's one thing as an LPN, of course, I've never done. What else do we have? Chest tubes. We learned about that in LPN school, but we haven't really dealt with it much. I haven't worked in the hospital a lot, so I don't know too much about the actual chest tube. So that, and then removing sutures, which we have done, but again, it's all about you in this role. So now this is what you can do and you should know how to do, and also trach care. So you have your theory part that you learn, which is going to be critical thinking, getting your mind together. Like, look, you can't go look for the RN no more. You are the RN. So you have that theory part of it, and then you have the lab part of it, okay? So far, it's been okay. It's just kind of like, again, I've been out of school for so long, so it's reframing your mind to think, okay, you're no longer an LPN, while you're in school, even though you are, but just saying when you take the test, you have to think like a RN. So reframing that mind, but also just learning new skills that you may or may not have already learned, okay? What's keeping me organized, y'all, look. So I went on Amazon. I love planners because I'm one of those people that, like, I need to understand what's going down to the T, okay? So I bought this planner right here. It is the Level Up RN Nursing School Planner. I'm not trying to plug them or anything like that, because I've had a million different planners throughout just life, period. But this planner right here is so dope, okay? You can buy one that's like 6 months long or something like that, or you can buy one that's like a yearly planner. So I just go through, this little part of it. Of course, they have their tabs for the different months here, so you can be organized that way. They do have a section where if you want to see it monthly, and then they also have, let me go here. I'm sorry, y'all. And then they also have the weekly. So here's one side of the weekly, and then here's the other side of the weekly. I don't know if you guys can see it, but let me go to where we are now, okay? So y'all can see what your girl been having going down, okay? Here we go, right here. Okay, so for the weekly, so as you can see right here, you have a section where you can write like your assignments that you have come in due for that week. You can also note, it says they have a section for like quizzes and tests, and also any additional tasks that you may have to do, like discussion boards. They have that right there as well. If you have like labs, clinicals, or simulations, like they have that there as well, which is really dope. This week or this semester, I don't have any actual like clinical schedule, so I didn't have that right there. Let's see, future assignments that's coming up is down here. Then they also have like weekly goals and things like that. For me, this is really, I like it. It's dope. It keep me organized, okay? Because I need to know which tests I have coming up. Also they have, let me see, these little check boxes here, which for some people, like, it might be minor, but for me, to make sure, especially when you're taking 5 classes, I want to make sure that all of my assignments are completed, because I want every point that I can get, you know, like no points left behind, okay? So I want every point that I can get. So for me, whenever I complete an assignment or even a test, like, I want to check it off on my planner. So I don't know, I just think this planner is really dope, and it's really helping me so far. We're on week 7 for this semester, so I just add that on there. But this binder has been planner has been everything for me to help me out. Let me see here. So this is a little paper that I made. I'm just so extra sometimes, y'all, okay? But it's my motivation. Look at this big old binder, okay? So for all of my classes, I have it all in this one binder. That's how I also stay organized. A little folder here. So one of my classes, like I told you guys, is this dosage calculation class. So I have that there. And then I have these tabs on the side that kind of tell me, you know, which section everything is in. So I'm one of them people, okay, braids, that have to have like everything so organized. So I have my syllabus printed out. What are those called? The slides. Y'all know what I'm talking about. I can't think right now. So I have those printed out as well. So I have those printed out, a whole bunch of whatever notes that's there. I went to Dollar Tree and purchased like these. Let me see if you see them here. Just these little blank little index cards. And so what I do is I cut them in half here. And your girl, I ain't spending no $50, $60 on nobody flashcards. I can make my own. So from my notes and for my slides, I make my own little flashcards. So like, here's one of the medications, and then like, you know, testing myself on some things like that. So that's pretty much it for this video, guys. I just wanted to talk about like the actual LPN to RN transition class, because like I said, I don't see too many videos that actually talk about it, like more details of what it's actually about. It's not as hard. Like, the people that I know that went through the bridge program was like, that was the hardest class. To me, this is not the hardest class. Of course, I ain't been through all of them just yet, but it's like, if this is the hardest class, then baby, we good. Like, we good, okay? But just learning, again, scope of practice between the LPN, RN, the CNA, learning your labs, your skills, to help you be a better RN. I take it serious. For some people, it's just like, oh, let's just get through it. But for me, I take it serious because ultimately, like I said, I am going to, not I want to be, your girl is going to it. And mark my words, I will have that white coat, okay? So for me, I take everything serious because when I become a nurse practitioner, I want to make sure I know what I'm doing, and whatever I communicate to my patients, like, I know what I am saying. It's nothing worse than when you are in front of a patient, you're trying to explain something or communicate something, whether it's to them or their family, and you don't know what you're saying, or you're like, wait, I don't know. You know, we don't know everything, but of course, the more knowledge that you have, the more efficient of a professional you can be. So that's all I'm trying to do right now. So you guys, I'm gonna make more videos, okay? Right now, job update. So of course, I'm in a whole nother state in school. So I am PRN at one of the facilities that's here. So I do that, and then I also am agency. That's really big when you guys get your nursing license, whether you LPN or RN. It's good to have a multi-state. That way, when you go to another state, you don't technically have to right away have that state license, because when you have a multi-state, you can just literally drive over there and work. So I've been doing my agency, and I also have been doing a PRN job as well. While I'm here, just kind of get me through nursing school, because I mean, five classes, and I see my next semester is another five classes. Um, yeah, your girl can't be just making bare minimum when it comes to finances, but working bare minimum. As far as like number of shifts that I have to do is important to me. So I will be back with more videos, you guys, I promise. So if you have any questions, drop them below. If there's any videos that you want me to do or expound on, let me know. But I will definitely be uploading and doing more videos as I go through this transition and the process of becoming an RN from an LPN. Love you guys. Bye.